Hello. So I know we just went over your results of a lot of testing, and we made sure that you are not having an acute stroke or a cardiac event. But we did see a left cerebellar infarct on your CT scan and the MRI. It is remote, which means that it was not acute and it happened a while ago without maybe you having symptoms, or if you did, you didn't know that that was what was occurring. We talked to the neurologist. They consulted with you. I know that they've spoken with you. And the main things that they want to implement in your health plan are to keep your cholesterol below 70 and to keep your glucose in a normal range so that you do not become pre diabetic or diabetic. And of course, we started you on the aspirin, which will help decreasing any clots that could occur. So, for your cholesterol, we looked at something called LDL, and that is what we want to keep below 70, that value. If you are starting to have an increased one, which you are, I think it was around 104, then that means there are more plaques building up in your arteries over time, which can cause occlusion and other symptoms. So, we started you on a high dose statin, but I know it's really important to also implement a healthy diet and exercise. A diet specifically for also somebody that is trying to manage their blood sugar is called a DASH diet. So it really focuses on counting carbs, watching caloric intake, counting your calories, and implementing a lot of good foods such as fruits and vegetables and protein, and I think more of like the whole grains. For exercise, uh, basically, the guidelines are to have at least 150 minutes per week. They would like for you to spread that over the week. The research shows that it works better that way, and no more than 2 days off. So, whatever works best with your schedule. And also, you can choose something that you enjoy. It doesn't have to be intense. I know that research has shown walking is very good for your cardiovascular health, your heart health. So, you can always start there and just decrease the amount of time that you are sedentary or sitting and not moving a lot. And I think if you have a job where you're sitting a lot, or if you have activities where you're sitting, maybe just try every 30 minutes to an hour to get up and move, and that can really benefit you. And I also wanted to make sure to tell you that I know this is a lot of information, and it might be better to start with making small goals first. So maybe start with something that you already know that you're good at. So if you know that you exercise about 100 minutes per week, maybe start there and increase to 120, or even if you want to jump to 150, and just get your confidence that way. And then you can slowly start implementing the other goals, such as a diet. So, just starting slowly on the DASH diet, or if you want to start all at once, whatever you think will help in making sure that you're steadily reaching all of your goals. And by keeping your cholesterol lower, by watching your diabetes or prediabetes, and taking your medicine, hopefully this will prevent you from having another stroke or a cardiovascular event. I know that there's a lot of history in your family with your mom and your sister. So hopefully all of this will benefit you. I'm going to send you home with some packages, but just let me know if you have any questions. Thank you.